How is everyone for day 2 of orientation week? I'll take that as everybody is doing wonderful.
Yes, Peanut. Yes, Savannah.
I'm doing okay. How are you?
I'm doing okay for day 2 of orientation. So welcome. I think we're missing 2 students. Najat? Anybody know Najat? And
Yes,
then
I'll text her.
that's okay, Kyra. And then the other person I'm missing is Zamir. Anybody know Zamir? Whale. Sharina Williams, what campus are you from?
So I'm from Port St. Lucie.
Fantastic, thank you. Okay. All right, so those are the 2 students we are missing. And Najat, is somebody's going to be reaching out to her? Is she from the Essington campus as well?
Yes, and Zamir's logging on now.
Okay, and I already know she's from Essington. Okay. All right, fantastic. Well, welcome. Welcome to week 1.
Professor, you didn't say my name. I just want to make sure that you have me on your schedule.
Who's that?
Alyssa Skinnell?
Yeah, yes. I don't have you. Were you recently added to the class? Oh, wait, I do
No,
have you.
no.
Yes, I have you. Yes, you're on my roster.
Okay.
I didn't
Yeah,
hear you say my
yep.
name either.
I don't hear my
Eugene,
name.
Eugene Young,
Yep.
anything?
Yeah, I'm taking I get a report at the end of class with everybody's attendance. So far, everybody that's logged in, I have you on my roster.
All right.
Okay, you have my okay.
All right. Everybody's on my roster.
Okay.
All right. We have a full class, 25 students, so we can't go much higher than that. So it looks like this class is going to be Essington, Port St. Lucie, and I do have one student from Centerville. So welcome to everybody. Welcome to everybody. Welcome to week 1 of orientation week. How's the week going so far? Have you had any other classes? Most of you are probably taking peds and med surg too. Is that right? Okay. So you haven't had peds or med surg too. Laugh out loud from Shireen Davis.
Sorry.
Oh, that's okay. Can you turn your camera on, please, Shireen? So welcome to week 1 of Concepts in Community Nursing. I'm Professor Marvel. I'll be teaching this class for the term. Welcome to everybody. I know this is a heavy term for everybody, or a lot of people that are on the PEDS Med-Surg 2 community track. I have my instructor page lists my bio. If you are inclined to read that, I've just passed 40 years in nursing in May. I did some military nursing at the beginning of my career, and then I went into a hospital in Denver and was the director of Women's and Children's Services. So had all the maternity, OB, NICU, PICU, did that for about 15 years. And then I retired a few years ago from the schools. I was a school nurse in Denver, or a nurse consultant for this big, large district in Denver with, let's see, 200 schools and 90,000 students. So that's where a lot of my community health, public health experience came from. And then after I retired, I came to Fortis. So I'm finishing up my 4th year here at Fortis, teaching the community class. Enjoy it. Enjoy it a lot, actually. Enjoy education, enjoy meeting all my students and working with them and assisting them in being successful. So obviously, my goal for all of you is that we all get across the finish line with this class. Okay?
paid the price from me.
Pardon me? That we all get across the finish line. And we do that by working hard, communicating with me, and staying on track for the class. So today we're going to do the orientation PowerPoint that's required to do on week 1 of every term. And then we'll go and we'll review the syllabus, and we'll review some parts of the modules that I want to make you aware of. Okay, and we'll review some of the announcements that I've already sent out. Okay, so that's how today's going to go. I still need to provide you the week 1 concept recording, which you'll be getting every week, and we'll talk about that in the modules. And that's to help prepare you for class and prepare you for quizzes, but we'll talk all about that. Okay, does anybody have any? Oh, I did receive a message from all the faculty, received a message from Dean Brown yesterday regarding schedule changes. If anybody's thinking about doing a schedule change, apparently the plan is to initially let all the campuses get all their requests, schedule changes, and then it will be opened up after that sometime this week. You'll be receiving an announcement in your shell from Dean Brown that will say, if you want to change class, put in a request, and there'll be a deadline. It's usually by the end of the week, but she has not sent that out yet. So I don't know if anybody's thinking about changing classes, but it sounds like you still have the opportunity, but I would first reach out to your campus.
Is changing classes, does that include changing teachers as well? Or no?
If you'd like, yeah. So I'm teaching 5 sections, Monday, Tuesday, and Friday, and then Professor Ford is teaching a Wednesday night class and a Friday night class. So those are the options.
Do you have a class, your time for Tuesday, do you have an
Pardon me?
on Tuesday, what time do you have available for your classes?
What
Is it
time do I?
only- Yeah, is it only at 1, or do you
Yeah.
have a morning class on
Yeah,
Tuesday?
no, just the 1 o'clock class on Tuesday. And then I have a class on Monday at 3 o'clock. And then I have a class on Fridays at 4 o'clock. Okay, so those are my classes. And then Professor Ford teaches Wednesday evening, I believe at 9 p.m. and Friday evening starting at 8:30 p.m.
Oh, the night classes?
Yes.
Oh, okay.
Yeah. Yeah.
All right.
So be watching for an announcement from Dean Brown sometime this week about putting a request to change schedules.
And we
Okay.
can email her directly.
Yeah, I wouldn't do that yet because apparently she's sending out a standard response. It said we're working with the campuses first for them to make all their changes, and then after that. So wait for the email because nothing's going to happen. She's not approving any schedule changes right now.
Right. Thank you.
Okay. Yeah, so just wait for that announcement. Okay. Okay. Anybody, we're going to cover a lot today. Does anybody have any questions before we get started? I always like to ask 2 questions up front. First is community. What do we think community nursing is all about? And my second question is, what have you heard about this class? So let's start with the second question first. What have you heard about this class? Trying to
Total
ease.
opposite of what we've been learning.
Pardon me?
It's the total opposite from what we've been learning.
What do you mean by that?
Like instead of thinking of like the nursing process when it comes to like hospital settings and everything, it has to do with like, okay, well, how are you going to do it before it even gets to that? So it's like the the order's reversed.
right? So one of the biggest challenges, I'll just tell you right up front, is changing your mindset for this class, okay? Changing your mindset. You're going to be delivering care. You need to think about delivering care in the community, okay? Not the acute care setting. All right. And so when you think about community, what kinds of settings are there to provide? Obviously, people leaving the acute care setting and people in the community need health care. What kinds of areas do you think we provide community care or public health?
Homeless people,
Pardon me?
the homeless people.
Homeless, right?
Schools.
Schools is a big one.
Correction
home.
facilities,
Correctional facilities,
In-home.
in-home, home health,
palliative,
hospice care, palliative care,
Would foster homes be one?
foster homes, community clinics, or
VA hospitals,
pardon me,
the VA clinics.
VAs,
Churches,
churches, yep.
Marxists.
Pardon me,
Marxists. The mosques. Like the masjid.
the what?
The mosques.
the mosques, that's what she meant.
Oh, yeah. Rehabilitation centers, assisted living facilities, memory care homes, dialysis centers, medical office buildings, right? I'm not sure, just real quick, I'm not sure who Zoom user is. If you could just put your name in the as your Zoom, that would be great. Make sure you get attendance. So as you can see, there's lots of different areas under that community umbrella that nurses provide care in the community. So we'll be talking about those areas and different types of community nurses, different roles, as we pursue this class over the next several weeks. But community nursing is synonymous with public health nursing. Okay, what about the immunization clinics, the public health nurses? It's all under the umbrella of community nursing. Okay, so the biggest challenge for you is to shift your mind from the acute care setting into the community setting, right? Because if you think about it, in the community, we potentially are providing care across the whole lifespan, from babies all the way up to the elderly and everything in between. Lots of different vulnerable populations. We'll be talking about a lot of those. Homelessness, the homeless population, populations with mental health issues, substance abuse issues. We'll be talking about disaster management. We'll be talking about occupational nursing, which is in the workplaces, hospice nursing. We'll talk about school nursing. We'll talk about infectious disease in the community, outbreaks, all these things that happen. If you think about where you live now, whatever your zip code is, think about all the vulnerable populations that live in your community. They need the care as well, right? Whether they be pregnant teens, homeless, people infected with infectious diseases, chronic diseases is huge in the community setting. Okay? So we'll cover a lot in this class, but this is really an introduction to what community nursing is all about. And the other thing too to remember is, even though you may not work in community nursing, let's say you work in acute care, you're always going to be communicating or collaborating with healthcare workers in the community. Let's say you're discharging patients and they need home care, they need equipment, they need services, PT, OT. You're going to be collaborating with community nurses. All right, so it's all very interconnected. All right, so think community in this class. Think about caring for clients in the community setting, wherever that may be. All right. Going back to, I'm going to follow up with Alyssa. We kind of just answered question number 1. question number 2, what else have you heard about this class?
Did you want me to answer that?
No, just you started the conversation, so I appreciated that. You know, this is a class that if you simply keep up with the class and the assignments, there's really not that much. Okay, I always tell students at the beginning of the term, carve out some time each week to get your community work done, because your 2 other classes, your Med Surg and Peds, okay, they have clinicals, sims, labs, right? So if you carve out a little bit of time each week to get your community work done and then move on to the other bigger classes, you'll be okay. Okay. And I'm just going to mention this because it's on the top of my mind, but we'll talk about this when we get to exams. Just so you're aware, for those of you taking PEDS, exam 1 for both of these classes, PEDS and community, falls in the same week, just for exam 1. Okay, I don't know if you've noticed that looking at the syllabuses. Week 4. So plan accordingly for exam 1. You have 2 exams, and I think they fall in the same. Is your PEDS on Tuesdays as well? Yeah, so you're gonna have in week 4, you're gonna have 2 exams on the same day. All right, so plan accordingly. For exams 2 and 3, it's not that way. They're in different weeks. I think your second exam for PEDS is in week 6, and community it's week 7. Same with weeks 9 and 10 for exam 3. But I always mention that ahead of time, and we'll talk more about that later on. But week 4, your exams are in the same week. That one exam. Okay, let's cover anybody have any questions before we get started? Okay. All right, I'm going to share my screen. All right, can everybody see my screen? Can anybody see my screen?
Yes,
Professor.
Professor.
Oh, thank you. Okay, all right. So let's see. You guys are towards the end of your program. Okay, so you should have quite an understanding of what online learning is at this point. All right, online learning is using your computer with internet access to participate in a class. Right? Myself, online instructor, has interaction with students throughout the course using all the online resources. During the term, I will provide guidance with your homework. I'll provide feedback, guidance to your group project. Okay, and over the course of the term, I'll be meeting with you guys, whether it's for exam reviews or tutoring, right? So I'll be providing you ongoing instruction, guidance, and learning throughout the term, right? This class includes weekly homework assignments, learning activities, quizzes, exams, case studies. Okay, you are required to complete the required coursework every week. Okay, and I already talked about the different campuses. Port St. Lucie and Essington are the bulk of the students in this class, and 1 student from Centerville. As far as issues, if you have any issues with anything, reach out to me. Okay, I always talk about communication being an important piece of nursing, our profession, and so communication is key. If anything is preventing you from being successful in this class, please reach out to me proactively. Okay, I can't help you if I don't know what's going on. Okay. You already have my Canvas email because I've already sent you a few emails. In my instructor page in your shell has my cell phone number. Okay, and my other personal email address if you can't reach me with the Fortis address. Okay, I have no problem with you contacting me on my phone. If you text me or call me, just let me know, just identify who you are. Okay, and what class you're in. But I always respond to texts, phone calls, emails in a very prompt way. Okay. This is an important slide for Dean Brown's information. My information is here as well. My email, my phone number here, as well as the instructor page, and then Dean Brown's information. If you have any issues with your other classes, with regards to clinicals, scheduling, Sims, labs, those are all campus questions. I can't help you with those. Okay, so I can help you with anything related to this class, but if it's campus related, or excuse me, clinical, Sims, labs, those are questions for your campus. Okay. Etiquette. I sent one of the announcements I sent at the beginning was classroom etiquette. So try and state your thoughts in a courteous, positive, respectful manner. Be mindful of how to express humorous or emotional statements. Sometimes these can be misinterpreted. Try and keep your comments relevant to the discussion topic. Try and be considerate of others' experiences, feelings, and perspective. Please use proper language. Don't type your messages in all caps. It gives the impression that you're yelling. I don't typically have issues with classroom behavior. I just don't. I will never call anybody out during class. If there's any issues, I'll always reach out to you after class and maybe set up a time to meet, but I don't anticipate any of that. Okay. Attendance. So everybody knows the attendance, right? Everybody knows the attendance. It's done in 15-minute increments. So, you have this class, you're scheduled to be here every Tuesday at 1 p.m. The class is scheduled to go until 2:40. I find with this class being an hour and 40 minutes, if we don't take a break, our 10-minute break, then we can be done at 2:30. Is that agreeable to everybody? And I'm very mindful of time. So we'll be done by 2:30. If anybody has any issues with not taking a break and finishing up a little bit early, please let me know. Okay. These classes are mandatory live sessions, just like your campus classes. Excuse me. Course activities in this class include discussion questions. There's one group project, week 7. There's a individual project due in week 9. There's case studies, there's 5 quizzes and 3 exams. And we'll go through all that. Right, your discussion board requires that you post your initial post by Wednesday night. So that's tomorrow night. And your peer responses are due on Sunday. We only have 2 discussion questions in this class, and they're in weeks 1 and 2. Okay, so this Wednesday, so tomorrow and next Wednesday are your only Wednesday due dates. This week and next week, everything else is due on Sundays. Okay. Academic integrity. There's a few slides about academic integrity. Before I start these slides, I would encourage you to review in your student handbook. It starts on page 5. It's about half page 5, half page 6, and it's the academic integrity section. This just supplements all that information, but please take a moment to read that in your student handbook. Okay. So, standards of professional conduct, student professional conduct, academic integrity. These are all incidences of academic dishonesty and violations of academic integrity, and they will be disciplined. Such acts cannot be listed exhaustively, but here's some examples of academic integrity issues. Cheating, plagiarism. All right, plagiarism meaning submission of the work of another person for credit, failing to properly cite your references for any of your work that's not original to you, copying the work of others, allowing another student to copy your work. Unauthorized use of notes or materials in exams, including talking to other students. Forging or altering assignments. Unpermitted collaboration, giving or receiving aid. We don't have take-home exams, or other academic assignment under the circumstances in which anybody else would know that whatever aid or resource you were using was not permitted. Another example is allowing other students to copy or use work that's not your own. Okay, providing answers from graded assignments to others. Example would be if you had classmates that had a later class in the week and you were providing them whatever the quiz questions were or exam questions. I would encourage everybody to have a look at the American Nurses Association Code of Conduct of Ethics for Nurses. Okay, this is the American Nurses Association represents all of us, represents our profession, right? So the Code of Ethics are ethical values, obligations, duties, and professional ideals for both us practicing individually and collectively as a profession. Okay, these are non-negotiable ethical standards that we should be living by. They're an expression of nursing as a profession, our own understanding of the commitment we have to society working in this profession. So I'd encourage you to have a look at the Code of Conduct with the American Nurses Association. It's right on their website. With regards to sites that promote teaching, this is a summary bullet slide of the academic integrity section in your student handbook. It's a bit more detailed in your student handbook, but I encourage you to go to your handbook and read that. Okay, so use of these sites does not promote honor, ethics, or integrity. And I can tell you that factually, these sites are being monitored. They're being monitored by administration. Okay, being found on any of these sites will place you on a heightened monitoring for your work for academic integrity violations. Okay, don't reference these sites when you're submitting your work, right? Submitting work found on these sites will result in a 0 for the assignment. And I've been on some of these sites, and some of the material, whether they be old study guides, old weekly notes, my stuff is on these sites, and it's the older version. We don't use them anymore, but still, I mean, there's class resources from this class on those sites. So a second incident involving these sites of academic integrity will result in a course failure, and that has happened. Okay, so utilizing these sites, whether you're perusing them, posting on them, downloading them, is going to put you at risk for being dismissed from the program, right? And obviously your campus and upper administration would be involved. Some of the examples are Studaco. That's where I found several of my documents on. Course Hero, Stuvia, and another one listed in your student handbook is ChatGPT, the whole AI information sites. So just be careful, okay? Don't be doing this, okay? Lateware policy, it hasn't changed, okay? Same as your past terms. Your late work is only accepted with prior approval, okay? You need to contact me if you're going to be late with something.
Hi.
And then, pardon me?
Oh, I'm sorry, Professor. My own
Oh.
camera is messed up. I have to like exit out and restart it
Okay.
in order for it to work. I don't know what's going on.
All right, no problem, Eugene. Thank you. So if you let me know, you'll be granted the 7-day, you'll be granted the 7-day late policy, okay, with a 10% deduction. Of course, that doesn't include emergencies, okay? So first and foremost, you've got to let me know if you're going to be late with something. Okay, if you don't let me know, it's a 0. Okay, if you let me know, then we'll talk about what's going on, and then you'll have up to 7 days to complete it. If for some reason there was an emergency, always provide documentation. All right, so if anybody has any emergencies during the term and they do come up, please get documentation, whether it be for late work or an exam, always get your documentation. Okay, and then if it's an emergency and there's documentation, then I don't have to do the 10% deduction. Okay, and then after 7 days, you can't submit anything. Okay. Questions on that? Like I said, this is no different than it has been before, but you got to let me know. That's where that communication piece. I can't help you if I can't help with you or work with you, unless I know what's going on. Okay. Attendance. I do get a report after every class. So I don't need you to put your names and campuses in the chat like we used to. We get a report after class. And so that report includes sign in time, sign out time. If you left during the class for certain increments, okay, because it's done in 15-minute increments. So if you come into class late, even a minute late, right? I have to mark it 15. We do a 15-minute increment, so it's 15 minutes. If you come in at 16 minutes after the hour, then it has to bump to 30 minutes. Okay, so try and be on time. All right. The great majority of you are on time today, so thank you. I appreciate that. But those 15-minute increments of being a couple of minutes late can add up. Okay. So attendance is taken by this report that I get. And, even if you come in at 1:01, I have to mark you those 15 minutes because that report that goes to the registrar every week or after every class goes right to your campus registrar. It's going to say 1:01. All right. So I can't not mark you for the 15 minutes. There's a lot of things I can be flexible with. Okay.
So your class isn't, most classes usually in the like the handbook and the syllabus, it's like 6 minutes. You get like a 6-minute leadway usually.
Nope. You need to be at class at 1:00, ready to go. I haven't heard of a 6-minute. I haven't heard of that. You just need to be on time. Okay. So when you sign in, if you could sign in with your full names, you need to stay on camera the whole time. You cannot be driving. You can't be driving in the car, right? You can't be in the car. Driving, passenger, parked on the side of the road. You cannot be in a car. Okay, I already had this happen yesterday. And so what I will ask is if you could please log out and then log back in when you get to a place where you can participate in class that's not in a car. Okay, and then I usually come off share a couple times during the class just to make sure everybody's on camera. But if you could just stay on camera, I would really appreciate that. And that goes for all your classes, and that has been in place all along. Okay. Attendance missed were recorded in 15-minute increments. If you miss 2 classes in a row, 14 days in a row, you're going to be dropped. Okay. Anyone without posting attendance in 14 days in a row, so that's 2 weeks, will be dropped without notification. Okay. So let's assume that you missed today's class because of an emergency. Okay. I still have to mark you absent, but that documentation that you will submit to me, I forward on to Dean Brown and she makes the adjustments. But if you miss a class for whatever reason, personal emergency, you are marked absent. And I always tell students, even though you're marked absent, if you would like to attend one of my other sections during the week, not to get attendance, but to get the content live, you're more than welcome to. I have no problem with that. In fact, I would encourage that. You don't have to, because I do send out recordings every week after class so that if you miss class or you missed a portion of class or you just want to review the recording of what we covered, you have that resource every week. Attendance taken daily, sent to the registrar. Period of less than 15 minutes will be counted quarter. Okay, went through that. So if you end up getting towards, so if you miss a class, for this amount of class, it's like 8.33%. But all those 15-minute increments, if you're late, chronically late, those will add up. And then if at the end of the term you have absenteeism in excess of 20%, you're going to be dropped a whole letter grade. And I've seen that happen. Okay, so you will start getting notified. Students who are absent more than 20%, full letter grade deduction. You'll get an email at 5%. At 10%, we're going to have to meet to discuss how we can get you back on track. At 15%, we have to bring in your campus and meet with them and talk about what's going on. So the level of intervention will depend upon how much class time you're missing. Okay, so again, it's best to be at class on time, participating, and there won't be any issues. But I do get that things come up. I get that. Just communicate with me, okay? And I'll work with you every step of the way.
Will
Yes.
something like what happened with my camera dropping and me having to log off and log back on?
No.
Okay, I just want to make sure that I don't have no emails coming.
Nope. That's all part of class activity. But if you were to log out and then come back in a half an hour, for whatever reason, send me an email. Hey, I was having my internet went out. Just again, I can work with you guys. I can work with you if you just communicate what's going on. Okay?
Thank you.
You're welcome. So steps for, what does the top of this say? 7 key steps to success. I would assume that you're already practicing these 7 steps. Okay? Reviewing your work that's due each week, completing your reading assignments due each week, completing any interactive lessons each week. We do some case studies during class, I think in weeks 3, 6, and 9. We'll break out into groups, go into breakout rooms, and I've got 3 different case studies that we do. And I think they're good case studies, and they pertain to the content we covered in that particular week. Attend live sessions weekly to get better understandings of the concepts. These classes are mandatory. There are rubrics attached to every assignment. So always look at your rubrics before you start your assignment, because I use the rubrics to grade, right? Obviously complete all your assignments and complete the quizzes and the exams, and we'll talk about those in a little bit. I would highly suggest you log into class 4 to 5 times a week to stay connected. Review course announcements at least weekly. I would highly suggest more than weekly. I post a lot of announcements, and so I'd be checking those every couple of days. Now, I have noticed that there were several students, and this was, I think, last night I checked. There were several students that hadn't even accessed the course shell yet. Okay, so that means that there were students that haven't done the syllabus or technology quiz yet. And until you do those 2 prerequisites, you can't even get to your shell. So for the students that haven't done those quizzes yet, I would suggest you get them done today, because you have a discussion question this week and your initial post is due tomorrow night. Does that make sense? So if you haven't done that yet, please do that. Successful. Keep in contact with me. That's the communication piece. Okay. Have a reliable internet connection, computer and laptop. Maintain some kind of a schedule. If there was ever a term to have good time management skills and organizational skills, it's this term. You got 3 classes, 2 of them involve clinicals, SIMs, labs. Okay, it's busy. Have somewhere, whatever your source of organization is, whether it's a calendar or phone, whatever, make sure keep organized this term. For class and exams, please identify a quiet place from distractions, and then read all your assignment directions carefully. Okay, you've already done it. You've already done this slide. You've logged on. Most of you have. You have my information. You have Dean Brown's information. I would suggest that you maybe save the syllabus to your desktop or print it out. Okay, and the syllabus goes through all the weeks and what we'll be covering. Want to make sure this bullet right here is important to confirm that you were given the correct textbook. Okay, so if you've looked at the syllabus, you know we have 3 books for this class. There is no PN community book. It doesn't exist. Okay, so you have 3 books for this class. And I sent those to you in an announcement. You should have all those books already uploaded in your e-library. Right? Fundamentals from your fundamentals class, Med-Surg from Med-Surg 1, and then your introduction to maternity and peds. That should already be uploaded into your ebooks. Okay, so I would have everybody this week double check that, make sure you have all your books in your library, and if you have any issues, please let me know. Okay.
So mine only has maternity and peds online. Because my other 2 were physical classes, so I have a Med-Surg book and a foundations book. I don't have an ebook for that.
Okay, as long as you have the book.
Okay.
Hardcover or, yeah, thank you. Thanks, Caitlin. That's a good clarification. Yep. Come to class prepared to discuss the concepts, attend additional review sessions offered by the faculty, meet with me to discuss any concepts you're struggling with, schedule tutoring sessions. If you're having technical difficulties logging in your student resources, it walks you through how to contact IT. Okay, so a couple of things about this slide. We will have review sessions before every exam. All right, so our exams in this class are weeks 4, 7, and 10. So there'll be 2 review sessions in week 3, and week 6, and week 9. And then in week 10, we do a couple of HESI review sessions.
What days do you usually do those on?
So let me finish my thought here. Professor Ford just provided me all of her dates for her exam reviews and her HESI. I have mine, so I need to update the spreadsheet and I'll be posting it in the announcement. So you will have all of the review dates scheduled for the whole term so you can plan accordingly with family schedules, kids schedules, work schedules.
I'm not in P right now. I'm in leadership, communities, and IV therapy.
Okay.
I don't have the same schedule as everybody else.
Okay. But everybody will have the same opportunity to do the reviews. So that you should be getting in the next 24 hours. It will
Are your
have
reviews recorded and like posted?
Yep. So you'll have the opportunity to attend 2 live review sessions if you would like. And then you'll also, Alyssa, have both recordings. All right. So yes, you will have that. Thanks for asking. Good question. As far as tutoring sessions, I'm always available to tutor with students. So you just need to reach out. Okay. In the course syllabus or the syllabus cover sheet that's in your announcement, I always list an office hour of the hour before class. Okay, and that's just to list something as an office hour. Okay, if you want to meet during that time before class, just let me know and I'll come on early. But know that I'm available morning, noon, evenings, weekends if needed to meet with you. Okay, that's not the only hour I'm available. I meet with students all times during the days and all times during the evenings. Okay. Talked about tutoring. This is a little bit blurred. We'll look at it in more detail when we get to the syllabus, but this is what we have in this class. We have 3 exams and we have our HESI. We do have 5 quizzes. I did send you an announcement. We'll go through that when I get to the announcements of what weeks the quizzes are and what weeks the content is going to be covered. Okay, you have 4 sets of NCLEX questions. I think they're weeks 3, 6, 9, and 11. 50 questions each with each of the assignments. You have a vulnerable populations project that we'll talk about that's due in week 10. You have a HESI prep assignment that's due in week 9. We're going to talk about that. Then you have 2 case studies that are on Evolve. We have 2 discussion questions, weeks 1 and 2, and then you have 1 group project, and that will be due in week 7. And that's the content of the course. And I'll talk about that in more detail when we get to the syllabus. I will turn on the homework grades in week 6. All right, weeks 6 and 7, the homework grades will be on, so you can see how your homework is affecting your overall grade. If you're turning in your homework and doing well, then it should bump up your grade. If you're not turning in your homework, it's going to lower your grade. This is not a course that you want to be a homework fail. Actually, any course, but you do not. There's just not a whole lot of homework in this class. You should be able to keep up with getting your homework in. And the reason why we turn it on for week 6 and 7 is because week 8 is drop week. Okay? And it gives you the opportunity to evaluate where you are. And on that syllabus cover sheet that I sent in the announcement, if you look at the bottom, it has the day the course starts, which is yesterday. It has a drop date and the ending date. All right, so take note of those. Everybody knows this rule, right? After your KGAs, so that would be your 3 exams, your HESI, and your 5 quizzes. At the end of the term, you have to have a 78 before your homework kicks in, right? Everybody knows that. Okay. So a minimum passing grade of a 78 is required for successful completion, right? And this is after the homework scores are added on. I'm happy to say I think it's been at least 3 terms that I haven't had anybody failing in homework. I will stay on top of you if there are issues with homework, right? If you don't turn in your NCLEX in week 3, you're going to get an email from me that says you've got, if you've let me know you're late, you're going to have a week to complete it. Okay. You must have 2 devices for exams, quizzes. I don't use the 2 devices for quizzes, even though it's proctored and everybody's on camera. I'm okay with doing it that way, but for exams, you do need the 2 devices, right? You need your laptop to run the exam, or phone, iPad to be on Zoom. Okay. So, quizzes. So we do have quizzes in this class. As I said, we have 5 quizzes. Quizzes are part of your KGA. So 5 quizzes, they're worth 5%. So each quiz is worth 1%. Okay. And those are done in class at the beginning, and they're done on camera. And if you look at the second bullet, it explains why. Quizzes are designed to be given at the beginning of class to allow faculty insight into the concepts students are struggling on. It requires you to come prepared for class. So what you will have each week to prepare for class, you will have a concept review recording for every week. You don't have week 1 yet. It's because I have to do it. Professor Kershaw is no longer with us. And so she had done, between Professor Ford, myself, and Professor Kershaw, we all took turns doing concept reviews. So I need to redo week 1. So you'll have that in the next 24 hours. Okay. But the rest of the concept reviews will come in your weekly announcement. Okay. You're going to get a weekly announcement every weekend. Week 2, like you got week 1 announcement information, week 2 announcement information. So what you're going to have to do, what you will have to prepare for classes, you'll have a concept recording in which we introduce and talk a little bit about the concepts we're going to be covering that week. You also have your PowerPoint. Okay. And if you've noticed, if you've opened it, when it says student notes, that attachment is simply the PowerPoint formatted so you can take notes on the side. Okay. And then of course you have your readings. And know that the quizzes, I developed the quizzes. The quizzes are developed from your prep work, from your concept recordings, from your readings. Okay, so it requires you to do those things prior to coming to class. Okay, so the quiz is 1 attempt. It's time for 15 minutes unless you have accommodations. Got to stay on camera while you do the quizzes. Okay, And then important, note this is important. Quizzes cannot be made up for any reason. Okay, even if it's an emergency, we do not make up quizzes. At the end of the term, if there were issues with why you didn't get to class and you missed a quiz and you filed an appeal, that potentially is looked at. But during the course of the term, quizzes cannot be made up.
So, Professor, you're saying if one quiz, like it's emergency, you have an excuse, but knowing that quizzes cannot be make up. But if it's one quiz because you're missing it, it's causing you to fail, can you reconsider?
Well, it depends on, you would file an appeal and, if it's the quiz that may be the issue, you potentially would be allowed to take the quiz. And that we're talking at the end of the term. Okay? But during the term, the quizzes are not able to be made up. Exams, no, there's no difference with the exams. Although I will send you guys, I'll put in an announcement. There's something about Exemplify now being compatible with one of the versions of Mac and OIS. So I'll send that to you in case it applies to anybody. But exams are no different. Okay, it's taken during class time. It's taken through ExamSoft. When all the exams get uploaded into the system next week, I will open up that practice exam. That practice exam you're asked to take every term to make sure your equipment is compatible. Okay, so I'll send out an announcement about that when that's ready. Okay, but exams are no different than last term. During class, proctored. Okay. You're only allowed one attempt in the exam. If you're having technical difficulties, and I review this prior to you taking any exam, stop. We try and problem solve what's going on. Okay. Anyone with accommodations, I mentioned this in an email I sent you last week. If you have accommodations, you need to provide me the documentation of your accommodations. They need to be reapproved every term. Okay, and anybody with accommodations, those extra, whatever the accommodations are factored into ExamSoft automatically, but you got to provide me the documentation. Okay. Exams are taken during last time. Okay, I want you to look at this last bullet. I have a lot of students who take exams on campus with a proctor, and that's perfectly fine. Okay, you just got to let me know. Got to give me at least 72 hours notice that, hi, I'm going to be taking the exam on campus. This professor is going to proctor me. Here's her contact information. And then I reach out to that professor. Yes, are you going to be proctoring? Get the dean's approval. And then I create a new exam for the students, a different exam for the students on campus, so that I can provide the proctor the sign-in information. All right. So if you think you might be taking your exams on campus, just plan ahead and let me know. And if there's a group of you, fine, no problem at all. But I need to hear from every student. Okay, for documentation purposes. You can't send me and say, 10 of us are taking an exam on campus. No, I need to hear from all 10. All right. So I have no problem with you. I have students every term taking exams on campus. You just need to give me some heads up. This is no different. Exams are proctored, got to be on camera, show the photo ID, 360. View, no ears covered. You do need to have a whiteboard though, or a screen protector, no paper. All right, so if you don't have a whiteboard at this point, if you can get to a dollar store and grab a small whiteboard, or you got to have a whiteboard by week 4 for exam 1. No need for a calculator. ExamSoft has a calculator built in. Missed exams. Again, this is the communication piece. Okay. If for some reason something's going on that you're not going to be able to take the exam, you've got to let me know prior. Okay. If you just don't show up for the exam without it letting me know, you just don't show up, that's a 0. Right. If you miss the exam for personal reasons, You will have up to a week to take it, but it will have that 10% deduction. And then exams missed due to emergencies will require documentation of the emergency. Once you get that documentation to me, I'll send it on to Dean Brown, and then you'll have up to 7 days to take that exam. Okay. And this explains what I just said. If you are having issues that may prevent you from being successful before taking exams, you've got to let me know. I can work with you. But after the exam, if you've already taken the exam, there's nothing, I can't work with you. I mean, you can't retake the exam, I guess is what I'm saying. Right? Of course, we want you to be, everybody to be successful, and it requires you to communicate before, okay, not after. Quizzes, talk about HESI. This class has one HESI. Okay, there's one attempt at the HESI. And HESI's usually around week 8 or 9. I have a master calendar of when the community HESI is going to be on your campus, and I'll provide that to you. I won't know it till for a few months. And just know the HESIs can be scheduled at any day of that week in week 11. It depends on campus availability, okay, and campus proctoring. But know that the community HESI could be Monday, Tuesday, Wednesday, Thursday, or Friday. Okay, and all of these 3 campuses I have all test on campus. Port St. Lucie, Essington, Centerville. They're all on campus in week 11.
So if our HESI is on a different day than what this class, like our lecture is, do we still have
No, we
lecture
don't
and
have
then
class.
HESI?
Nope, we don't have class in week 11. Your week 11 attendance is taking your HESI. All right, think that's a good question. And as it gets closer, I remind you, we don't have class in week 11. Okay, because you'll be taking your HESI. And then I'll be sending this out prior to taking your HESI. This is not new. This is your remediation hours required based on your HESI score. Okay. Same kind of exam security with your HESI. You're showing your ID, camera on. Full face must be visible at all times. Okay. Contact your instructor if you have any problems or if you would just like some additional help. We've already talked about that. Homework assignments. I'm assuming at this point you are already planning, prioritizing, completing your work, and submitting your work. Okay, I'm assuming you're already doing those. Whatever, this is just an example for planning and organizing. Whatever system you use for planning and organizing, please use. But you got to have some kind of a system this term. We already went through the late work. NCLEX. Purpose of NCLEX practice exams is to prepare students to sit for the actual NCLEX. We're talking assignments here. The assignments are covered in each nursing course. So, like I said, you have 4 assignments. Okay. In the weeks that you have the assignments, there is a link from the module to start your NCLEX assignment. Use the link. Don't go in from evolve.com because it's not going to be able to provide you the PDF. Okay. You need to go in from the link in your module. All the subcategories that you select for your NCLEX questions are already preloaded into that week. Okay, so it's all there for you. I need you to submit. One group of 50 questions, not 2 25s or 5 10s. It needs to be one batch of 50 questions. Okay, so here's my mantra on that NCLEX questions. NCLEX questions are a really good learning tool. They're a really good resource when you get the rationales. I'm a big believer in learning by rationales as well. So let's say you start your NCLEX and you get a 20. My suggestion would be that you review the rationales of what you got wrong and retake it. You can take your NCLEX, you can do your NCLEX assignment multiple times. You can only submit it once. I always say that if students submit between a 45 and a 50, I know that they have got a lot of learning out of that assignment. Okay. I don't know how many times you did it. You've only submitted it, whatever you decide to submit. But if you're submitting 20s and 30s out of 50, that tells me that you haven't taken the time to go through the remediation or the rationales and try again. So I like scores between 45 and 50, although you can submit whatever you want, but know that you can do it as many times as you want. Okay, you can repeat the questions as many times as you like to obtain the highest score before you submit it. Okay, it's up to you. But there's a reason we do 200 NCLEX questions. It's to help prepare you for the NCLEX exam. I have students over the last terms that have told me that they do extra NCLEX questions every week or every couple of weeks. You know, you can go into the study mode, right, for NCLEX and pull up and do your own categories. A lot of students in this class that do extra questions do adult health or pediatrics, right? Because this class involves med-surg, adults, geriatrics, pediatrics. So if you want to go in and do extra questions, I mean, obviously you don't submit them, it's for your own learning and your own practice, but I've had many students tell me that that has helped them quite a bit going into the HESI. I can't accept any screenshots for HESI. I need the full PDF document, and this is standard across the board. Okay, it's usually 12 to 16 pages. And it allows me to go in and look at, did you select the correct categories all the way through? So don't send a screenshot. And again, go through the module link to start your NCLEX. Okay. 50 questions. Went through that. HESI, we don't have any, let's see. We don't have a HESI practice with this course. Okay. The other thing we don't have with this course, but you are going to have it in, I know you're going to have it in PEDS, is the CJ Sims. Okay. And you haven't got to PEDS yet, but have you guys done your have you done CJ Sims in prior classes? They're awesome. They're awesome. A couple terms ago, I taught a class up in the RN community and they used the CJ Sims. I'd say the same thing about CJ Sims as I say about NCLEX. Okay, even though you don't have CJ Sims in this class, what we have is 2 case studies. Okay, I would go in and do some extra CJ Sim assignments. You can go in and create your own CJ Sim, right, with adult health or pediatrics, right? Because CJ Sim is your next gen learning, right? It's taking your knowledge and applying it to clinical judgment. That's what CJ Sims are, clinical judgment simulation. It's about taking care of clients. All right, so you can go in and do community CJ Sims. So I would encourage you to do that as well. Okay. Even though we don't do CJ Sims, this is part of the orientation packet, but we just talked about, even though we don't have them in this class, I encourage you to practice them. They're patient care scenarios. They're meant to enhance your learning. And it is applying your clinical knowledge to clinical judgment. Okay, as far as papers, we'll go through those when we get to the syllabus. Rubrics, you have access to APA, we talked about that. Okay. All right, let's go to, all right, I want to go to announcements. All right, can everybody still see my page? Okay, I want to cover announcements, or a few of the announcements I've sent you. So you have your online etiquette. I gave you an announcement on academic integrity and submitting your work. Please read that. It's the same as we talked about, but in a little more detail. For those of you that have an issue with math, please take advantage of this math resource announcement I sent you. Okay, Professor Bogart, some of you may have her for PEDS, has a YouTube channel that she does a basic math tutorial, simple math. Okay, and she has 3 handouts that accompany that tutorial. It's not that long, I think it's about 40 minutes. I would highly encourage you to have a look at her YouTube math tutor session. And then these 3 handouts are really cheat sheets for basic math that's going to be covered on the exams in community and in PEDS. This will help you with both classes. All right. So if you, like I said, have an issue with math, please take advantage of that resource. Okay. APA, you're expected to use APA format for your discussion questions, for your group project. So have a look at APA information and guidelines. Here's a announcement on how to be successful on discussion boards. Make sure you answer all of the discussion question. I think for this week it says identify a vulnerable population in your community and what resources do you have for them? What resources don't you? You have to answer all the parts of the discussion question. And this how to be successful on discussion boards gives you guidance on how to be successful. There's your syllabus cover sheet that gives you the course start date, the drop date, and the end date. It also gives you my office hour and my Zoom. Okay, this, I want to make sure you see this. This is your quiz announcement. Okay, there's going to be 5 quizzes during the term. Here are the weeks that they'll be given and the weekly content that will be covered. All right, quizzes are given at the beginning of class. Please come to class prepared to take the quizzes by reviewing a couple things, your concept recording, the PowerPoints, and your weekly readings. All right, so you'll see that next week at this time, at the beginning of this class, we're going to have a quiz, quiz 1. It's going to cover content from weeks 1 and 2. So you should have reviewed the concept recordings, the PowerPoints, and done your readings. In week 3, we'll have quiz 2, but it only covers content from that week. All right, so this is giving you specifically which week the quiz is in. Like in week 5, since week 4 is a exam week, quiz 3 in week 5 will have to cover contents in week 4 and 5. All right, so you've got 3 quizzes that are going to cover 2 weeks of content, and you've got 2 quizzes that will cover a single week of content. Okay, so if you wanted to know when the quizzes are and what they're covering, it's all right there. Then you got your welcome to class, content cover quizzes, orientation. Oh, the other thing is you have a copy. This orientation PowerPoint from week 1 is what we just went over. You have a copy of that if you want to review any of the slides. And a lot of times students ask me questions during the term about late work or exams. I will refer them back to a specific slide in the orientation PowerPoint. And then you're always going to get a weekly announcement from me, all right, over the weekend. I usually try and get them out by Saturday, if not Sunday morning, all right? So in this weekly announcement, you're going to have what I copy and paste readings right from your syllabus, okay? And then I go over what we have to do. What's going on this week? Here's what you have to do. Any additional information I need to provide you. And then at the bottom of the announcements, you will have your concept recording for that week, your PowerPoint, and then your student notes, which is that PowerPoint reformatted so you can take notes. Okay. And then any other handouts I need to send you. So in this week, I sent you your study guide for exam 1. I like to send out study guides in the first week that the exam is going to cover. So exam 1 will cover weeks 1, 2, and 3. So it's a list of all the concepts that we've covered that we'll be covering. So you can print that out and take notes on it if you want, because that's what you're going to bring to the reviews, or that's what you're going to use when we go to reviews. Okay? So you already have your exam 1 study guide to start working on. Okay? So what I'll be sending you additionally this week is the week 1 concept recording. And I'm sorry I didn't have that ready for the weekend, but you will get that in the next 24 hours. The other thing I'm going to be sending you this week is the exam review schedule for the whole term. Exam 1, 2, 3, and HESI review. Okay? Modules. Let's do the syllabus first. A couple of things I want to point out in the syllabus. You can read through the course description, the student learning outcomes, course objectives. You can read through those. Here's your books. I copied and pasted this right here into an announcement. Here's what you need to have. Okay, make sure you have the correct editions. And then you have your Nurse Think. Even though we're not using Nurse Think, which is your CJ Sims, but you do have access to it. There's a couple of references. There's a couple of books in your reference package I want to point out that I've heard from students over the past 4 years that they use. Okay, one is this Calculating with Confidence. Okay, that's in your student resource reference package. If you have issues with math, in addition to watching Professor Bogart, please look at your Calculating with Confidence book. It goes through all the basics. Okay, the other resource that students use a lot is this, your comprehensive review for NCLEX PN from Silvestri. This is where students will go in and do extra NCLEX questions. Okay. And then the other resource that students use, tell me they use all the time, is this next one, Strategies for Student Success on the Next Gen Test, on your NCLEX. All right, so I just want to point those out, that you do have access to those and extra questions for practicing. And again, since this class covers across the whole lifespan, you have opportunities to do pediatric extra questions, adult extra questions, geriatric extra questions. And the more you can do, the more it will help you prepare. We already went through attendance, absenteeism. Okay, so here's a clearer picture of what we have this term. All right, your 3 unit exams, your HESI, your 5 quizzes, your 4 NCLEX assignments. So each NCLEX would be worth 1.25% since there's 4 of them. Vulnerable populations, HESI prep, which we're going to talk about in a minute. You got 2 case studies. I think they're in weeks 4 and 7. Your 2 discussion questions, which are weeks 1 and 2, and then the group project is in week 7. Okay. And then if you haven't had a chance to read your course outline, I would suggest you do. Okay. It goes through all the weeks and what we're going to be covering. On the left side is all the concepts we're going to be covering. So this week is Introduction to Community Nursing, Levels of Healthcare Prevention, Healthy People 2030, Introduction to Vulnerability. So in next week's class, I'm going to cover weeks 1 and 2. Okay. So on the left side is what we're covering, the concepts. And then in the middle is your reading activity. So I usually copy and paste this middle box right into your weekly announcement. Okay. And then you have the assignment, what's due, on the other side, on the right side. Okay. But look at what we're going to be covering in this class. Intro to Community Nursing. Levels, you're going to hear a lot about levels of healthcare prevention. We're going to talk about primary, secondary, tertiary. And then an Introduction to Healthy People 2030, which the website is right here in the middle. And then we're going to do an introduction to vulnerability, since a lot of the clients we care for in the community are vulnerable. Next week, we'll talk about school nurse, growth and development, common childhood ailments. And your actual discussion question next week is common childhood ailments. We'll talk about family nursing, family health risks. As we get into weeks 3 and 4, we start to talk about specific vulnerable populations, the migrants, the rural population, homelessness, people, individuals, families that live in poverty. And week 4, we continue on with pregnant adolescents, LGBT population, mental illness, alcohol, tobacco, and other drug problems and how they affect the community. Then week 5, we start to talk about different roles that community nurses have. Hospice, palliative care, death and dying, faith and spirituality, and ethics. We'll talk about occupational nursing, environmental health nursing, and a lot of what we do in the community is teaching. So we'll talk about barriers to learning. How do we reinforce health education? We do a lot of health education in the community. Week 7, we'll get into infectious disease prevention and control. We'll specifically talk about HIV, TB, STDs. We'll do a little section on bioterrorism and disaster in the community setting. And then week 8, we'll talk about home care, community resources, how is case management carried out in the community. And then we'll do a large med-surg section in week 8, which is care of the complex chronic illnesses in the community. Big issue in the community, complex chronic illnesses. And then we'll finish up week 9, talking about human abuse and violence and cultural influences in nursing. So we cover a lot. Okay, a couple things I want to point out in the module. When it says in your syllabus, Canvas reading, right? So let's look at, if it says Canvas reading, it's going to say book reading, Canvas reading. So let's just go to week 1. This is the way each week is set up. Okay, it gives you what concepts we're going to be covering. So I take that right from the syllabus. Okay, if you keep going through it, it will tell you what your reading is. So here's your weekly reading. If there's 3 different kinds of reading in this class. There are whole chapters. There are snippets of a particular chapter, maybe a couple of pages, and then this Canvas reading. Okay, if you are assigned to read a whole chapter, at the bottom here where it says reading resources, you're going to have a PowerPoint. So in your fundamentals book this week, you're asked to read chapter 1. So you'll have a PowerPoint to that. Okay, but you'll see in your med-surg book, you only have 1 page, community care on page 123. You're not going to have a PowerPoint for that because we're not sending you a PowerPoint if you're only expected to read a portion of the chapter, right? Doesn't make sense. Okay, if it says see Canvas course, hopefully, if you've taken a look at week 1 yet, these are all embedded. Your Canvas course reading is embedded right in the module. All right, so if I keep going to next, we're going to see all 4 of these reading pages. Introduction to Community Nursing. Levels of healthcare prevention. So Canvas reading means embedded in your module. Okay, does that make sense? Yes? No? Okay, a couple of assignments. So the way I do assignments is all assignments except 3 open up on the Monday they're due. So your discussion questions, your NCLEX assignments, your case studies, they all open up on the Monday. However, there's 3 assignments I've opened up as of yesterday. Okay, the first one is in week 7. You have to go to when it's due. Okay, and this is your group project. So just make a note. Okay, there's one group project. It's due in week 7. I open that now. Okay, after I get my official rosters and everybody's made their schedule changes, in week 3, I'm going to send you out your groups. Okay, I try and keep them on the same campus so that if students are on campus, maybe they can work on it. All right, so I try and keep, it doesn't work out exactly always, but for the majority of the time, I can keep students on the same campus in the same groups. Okay, and it's a research project. I'll be sending out your groups and I'll be assigning you an infectious disease. Okay, and then look at the rubric. As a group, you'll get together. Somebody has to do the introduction in history. of the disease. Somebody has to do who's affected, how is it transmitted. This is a rubric, this is how I grade it. Symptoms, pathology, cure and treatments for the disease. How is a person's daily life affected? And then your resources. Okay, so that assignment is open now, even though you don't have your groups. So really can't do anything with this assignment for a couple of weeks. But once you get your groups in week 3, if you want to start working on it, work on it. Okay, because the end of this term gets heavy. Okay, and I want to cover 2 more big assignments that are open now. One is called your HESI prep. Okay, this is in week 9. All right, I want everybody this week, today, or in the next couple of days to go to this HESI prep. And I want you to download it and put it, either print it out or put it on your desktop. Probably put it on your desktop because it's a Word document and you could be filling it out. This is really important. This is why I talk about this in week 1. Okay, this ends up being your study guide for your HESI. I'm waiting for it to pull up here. This is your study guide. It's blank right now, but okay, why won't this open? Whoops. Shoot. Oh, there we go. Okay, I'm going to pull this over here. Can you guys see this now? Yes? Okay, this is what it looks like. Take this up, take this and put it on your desktop. It's a Word document. You can be filling it out as we go. This is a work in progress document. It's not due till week 9. Okay, and this is worth 5% of your homework grade. Okay, all these topics on your left are broken out into concepts we're going to cover during the course. Okay, these are topics that are asked about on your HESI. I pull these topics right from HESIs, right? There's a question about anthrax. There's a question about level 1, 2, and 3 phases. There's a question about disaster planning. I don't know what the questions are because I don't do the HESIs. They come from that 1200 bank, like your boards, but I know the topics that are covered. All right, so use this and fill it out as you go. Don't wait till week 9 to do this. Okay, if you can maybe go into this every couple of weeks, or go to what we've covered and fill it out. Now there's going to be some of these boxes that I don't cover. That's part of your med-surg class or part of your pediatric class. So when I say community pulls from all these other different classes, it does. When you get down to health promotion and teaching, there's some boxes here like lipid screening. You're going to cover that in med-surg. Eczema with school sports, you're going to cover that in med-surg. There's a couple of, we'll cover a lot of this, but adolescent seatbelt safety. When you read about growth and development in your week 2 reading, you'll be able to complete that. So this is a work in progress document. I know it looks long. I know it looks tedious. However, it's going to be your study guide. And I always talk to my students in week 12. One of the questions I ask them as we do our exit meetings is, how was the HESI prep? Did it help you? And overwhelmingly, I get from students that it was excellent assignment. Yes, it was a lot of work, but you're going to get out of it what you put into it. If it's blank until week 9 and then you're scrambling to fill it in, it's going to be a long, tedious assignment. If you want to start working on it week 1, all the answers to these topics are going to be either in lecture, in your book, or in your books. We may not cover every single topic in class, but they're covered under the concept that we're going to review. And I get a lot of questions. How do you fill it out? Think about clinical judgment. Okay. So anthrax incubation. If you look at the directions, complete the assignment, please use the nursing process guidelines when addressing completing each topic. I don't need every box to have A, D, P, I, E. I need you to think about How would you care for a client who potentially had an anthrax exposure? Okay, disaster levels 1, 2, and 3. What are they? What's a 1? What's a 2? What's a 3? What's important to know with disaster planning? Right? What's red tag triage? As you will learn in disaster, there's all these tags: an orange tag, a yellow tag, a red tag. There's a question on HESI about red tag triage. What do we want to know about disaster communication? So think about this as your study guide. There's no right or wrong way to do this, as long as you are thinking clinical judgment. Does that make sense? Any questions about that? So this is an assignment to pull out and start early. Then the last assignment, I need to be mindful of time because I only have 3 minutes here. Oh no, is in week 10. Okay. And that HESI prep assignment is open now. I opened it yesterday. And this week 10 assignment, it's called your Vulnerable Populations project, is also opened. I opened that yesterday. This is an individual project. It's a PowerPoint presentation. Okay. It's an extension of your week 1 discussion question. You're going to be selecting a vulnerable population in your community. Okay. I gave you a list of potential vulnerable populations. You can go outside of this. I had people doing veterans. I had a student yesterday ask, can I do prisoners? Since she works in a correctional facility, of course. Whatever vulnerable populations you want to do. And it's a research project put into a PowerPoint presentation. If you look at the rubric, it tells you exactly what your slides need to have. What's the population? It gives you detail. Health risks gives you detail. Resources gives you detail. Service gaps, meaning services you don't have for this population, gaps. All right. So if you want to look at this assignment in week 10, it's open for you. But again, think about it. We've just talked about week 9 is your HESI prep. Week 10, you have an exam. And week 10, you have your vulnerable populations. And then week 11, you jump right into your HESI. So after week 8, this class gets busy. All right. Not to say it's not busy between now and week 8, but it's manageable. But if you haven't started these projects prior to week 9 and 10, it's going to get real busy at the end for you. So that's why I like to talk about these up front. Okay. So your group project, your HESI prep, and your vulnerable populations assignments are all open. Everything else you'll be doing starting on the Monday of the week.
I have a question. Where can I find that HESI preparation page that you pulled up?
It's right on, it's week 9.
Week 9?
Yeah. And it says download document. Okay. So you got to go to week 9.
Yeah, I'm in week 9. All I see is domestic violence and cultural case study. Oh wait, here we go. Prep assignment.
Should say HESI prep assignment. Yep.
Okay. Okay.
Got it?
Yep. All right.
So just, you know what, just download that now, everybody. Put it on your desktop. Let me just make sure I've gone through everything. Changing schedules, announcements, books, concept recording. I need to send you the review schedule, groups by week 3, HESI prep.
And then you also had pulled up an outline for the quiz and the exam for the first week. Would that be in week 1?
Well, go to your announcement that says quizzes. And it's very specific when each quiz is given, which week, and which content weeks it's covering. Is that what you're asking?
No, because I saw that you had opened it up on yours. It was like a blueprint. Like we could write our own information in there.
Oh, that's your study guide.
Yes.
Right? Yeah.
Yes, the study guide.
So I would open that, save that to your desktop. And
Where
then
can
next
I
week,
find that? Because I'm trying to look for it and I can't.
it's in your week 1 announcement at the bottom with all the handouts. It says exam 1 study guide.
Okay, boom, got it. All right.
See that?
Yep, thank you.
Okay. Yep. Other questions?
No, that was it for me. Thanks.
Okay. Anybody else have any questions? Remember, you can shoot me an email if you think of a question today, tonight, tomorrow, shoot me an email. Okay, has this been helpful to go through everything in detail? This is a very doable class. Actually, I think at the end you'll really enjoy covering all different aspects of public health and community. It's a very interesting class, right? You just need to set your mind straight and get it focused in the community. All right, not get out of the acute care setting when you come to this class. Think of taking care of people in the community. You should drive around your community. Think of all the sick people. Who takes care of them? Community nurses in whatever role they're in, right? I take care of sick kids in schools, right? The occupational nurse takes care of sick employees. Hospice nurse takes care of people in hospice. So I think it's a very interesting class. I don't think it's a huge workload. If you wait till the end to start doing some of this stuff, it becomes huge at the end. So just stay on top of it. Just carve out a little bit of time each week to get your community done. And then move on to med-surg and peds, right? Because your community's done. That's from past experiences over 4 years. That's the best advice I can give you. Just carve out a little bit of time each week. Okay. So I'm a couple of minutes over. I apologize. If anybody wants to stay on after, let me know. It was really good to meet everybody. I hope this was a helpful class. I'll be sending you the recording of this class so you can review it at any point later this afternoon. Okay, so have a good rest of the orientation week, and it was nice to meet everybody. Okay, have a good rest of the week.